Uganda remains among the countries with the highest levels of alcohol consumption in Africa, with World Health Organization linked estimates putting annual consumption at more than 12 liters of pure alcohol per person. Projections by the Uganda Bureau of Statistics place the number of alcohol drinkers in Uganda at approximately 5.67 million. The broader public health studies estimate figures reaching up to 12.6 million people. The most striking point is that Uganda has a relatively smaller proportion of people who drink, but those who do drink can consume heavily. The 2019-2020 Uganda National Survey found current alcohol consumption at 12%, down from 17% in 2016-2017, indicating a decrease in alcohol consumption in the country. Over 70% of the market comprises unrecorded, illicit or artisanal homemade brews.
We advise and educate the people that alcohol is dangerous to our bodies, especially when consumed in large amounts. And therefore, there is need for regulation of production of alcohol, of consumption of alcohol, and the trade and business of alcohol. It becomes very important.
In a storm of a damning World Health Organization report, the health minister faces a difficult question. How does Uganda confront a culture in which alcohol is deeply embedded in social and economic life while protecting public health?
For instance, there are questions to be asked. Who should access alcohol? Should our children aged 4, 5, 10 years access alcohol and consume alcohol? No. Should we allow Ugandans to be in bars 24 hours consuming alcohol, and yet they must use their time for production and so forth? So all these things must be regulated.
For many households, the consequences can begin quietly. Money meant for food or school fees diverted to alcohol, productivity, domestic tensions rising, and health complications appearing only after 10 years of harmful drinking. Research published in 2026 estimates that alcohol use disorder affects nearly 1 in 10 adults in Uganda and contributes significantly to the country's health burden. However, Uganda also faces concerns of illicit alcohol. A recent study notes that a substantial share of alcohol consumed in Uganda is unrecorded, raising additional questions about safety, regulation, and taxation.
There is need for a strong regulation, and therefore we need a law that prescribes how the whole industry of alcohol should operate, but also to guide the people on issues of consumption of alcohol, and also the issue of the quality of alcohol which should be allowed on the market in Uganda.
But the conversation is not simply about banning alcohol. It is about prevention, responsible consumption, protecting young people, enforcing existing regulations, and ensuring that people struggling with alcohol dependence can access help.